Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 73, some survey results on why having health insurance doesn't mean squat. In this episode, I discuss a recent survey which illustrates why having health insurance often doesn't mean squat. The survey came out about 2 weeks ago, and it discusses some of the economic consequences that can happen when you have and don't have health insurance in the United States. Note, I will be citing several statistics during this podcast. Please don't get lost in the numbers. I will provide a link to the report in my description. You can find the numbers there. The important point to remember is that these statistics would not be an issue with single-payer Medicare for all. There would be no medical debt, and everyone would be covered with Medicare for all. Now, let's discuss the survey. The survey is titled, 1 in 4 Americans with medical debt owe more than $10,000. And the title alone shows a problem with our healthcare system. Getting healthcare should not cause anyone to go into debt. As we shall see, the survey also describes other harmful economic effects of the U.S. healthcare system. So, 56% of adult Americans, those 18 and older, have some medical debt. This again demonstrates a failure of our healthcare system and demonstrates that our healthcare system is seriously broken. I would not want to drive a car or use any product that failed more than half the time. I do know that if I were listening to a podcast and the sound went out more than half the time, I would not be able to listen to it very long. Now, of those Americans who have medical debt, more than half, 56%, have health insurance and 59% lack health insurance. So whether you lack insurance or have insurance, your odds are greater than half that you will end up with medical debt. Hidden behind these numbers is how often people skip medical care because of costs, as did more than 1/4 of adults in 2017. Medical debt has serious implications for 73% of the people who have it. 26% remain in financial hardship because background and credit checks reveal their debt, preventing them from finding a job. 24% delay getting married, and 22% delay having children. 43% can't save for retirement because of their medical debt, and medical debt prevents 46% of Americans from buying a home. What these figures don't reveal is the other sacrifices that people make because of medical debt. They go out to eat less. They take shorter and fewer vacations. They sometimes need to buy less at the grocery store. These problems and sacrifices drag down the economy as the medical debt reduces spending in other areas. Of those with medical debt, 43% are on a payment plan. 25% are negotiating to get their debt reduced or erased. 17% aren't making payments on their debt. 23% are substituting one type of debt for another by using credit cards to pay off their debt. 21% borrow money from family and friends. 20% are working multiple jobs to attempt to pay off their debt, and 14% are considering declaring bankruptcy. I know that there are a lot of figures in this podcast, and, as I mentioned previously, please don't get lost in them. The important thing to remember is that all this economic pain and suffering is unnecessary and could be solved with a couple of simple solutions. We implement single-payer Medicare for all and then cancel all medical debt. This would end medical debt and allow people to get the medical care they need when they need it without having to worry about cost. That would mean something. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.